Ton. Where are you going to? Vegas. Oh, he's the traveling nerve. Whoop, whoop. Okay, cranial nerve 5. This one is fun for me. Hopefully fun for you. So guys, here, this is a hint for you, the few that are actually online with me. Um, Here's the question I have for you guys. When do you see men huddle? Football. That's the only time you see men huddle. When do you see women huddle? There's two big events that happen for women to huddle. And men, if you see women in a group huddling in a circle, run, especially if your spouse is there. So this is why. What are two reasons why women would be in a little circle going, staring at something? Oh my God, so cute! Even if you have 7 or 8 kids, guess what? When a woman's in a circle and she's staring at a cute little baby that's so adorable, what's she gonna say? Honey, I want one. Where are you? Where are you? So, okay, so we're doing cranial nerve 5. Oh, okay. Let's do another one. So we got the baby out of the way. Guys, here's another reason to run. Oh my God, it's so beautiful! What's the second reason? Ring, baby. Okay, here's the lesson you're going to learn right now. So, let's say that the women in the circle, their husbands work at the same place. They're all radiologists or orthopedic surgeons. So now, this girl just got engaged and she has a big fat rock on her finger. Guess what the woman that's standing next to her is? If her rock is nicer, prettier, and bigger, and their husbands make the same pay, she's going to be like, honey, I need a new ring, right? She won't say it, but she's going to look at you. So here's the trick. Watch. I can't do this online, but I bet you all the girls are going to be agreeing with me. Ladies, if one rock is good, isn't 2 better? Oh, yeah, the guys are like, wait, no, 1 is good enough. No. If 2 is good, isn't 3 better? Oh! But why settle for 1 hand when I could have both hands? And we're going to say this together at home. You're going to say, oh my, Trigeminal. And if he doesn't buy you the bigger rock, just slap him so he feels the pain, right? So cranial nerve 5 is called trigeminal, and there are 3 branches. There's oh my. And the first branch is ophthalmic. The second one is maxillary, right? Max has a mustache. And then last one is mandibular. So I have, oh my, trigemini. And you slap him with your 5 if he doesn't respond. Why? Because cranial nerve 5 is also associated with pain, temperature, and crude touch, right? Crude touch, a little bit of slap. So we have cranial nerve 5 is called trigeminal. We've covered all of the cranial nerves and hopefully a fun way for you guys to remember for future use. So I have 1, 2, 3, 4. Wait, 4 is like this. 6, down and out. 5, 7, 8, 9, 10, 11, 12. Enjoy. So let's go through the nerves, and then I'm going to actually require that you guys know sensory, motor, or both. So you have to know whether or not something is sensory, if it's motor, or if it's both. So here are all the cranial nerves, or at least some of them that are exposed so you can see them. Here's the rest of them. Olfactory, cranial nerve 1, from the nose, sense of smell. Cranial nerve 2, vision, from the eye, optic nerve. And then we will actually cover a visual pathway a little bit later. So don't worry too much about this. Just know chiasm is cross, it's the crossing. And we are going to go through this pathway. I love this pathway for vision. So we will go over light, crispy apples, very pricey Olgo. And oculomotor moves the eye. It moves all of the muscles of the eye except for what 2 muscles? Lateral rectus, which is controlled by 6, which is also called abducens, and superior oblique, which is controlled by number 4, which is called trochlear. And here we go. So cranial nerve 4 controls superior oblique. Cranial nerve 6 controls lateral rectus. So here's the muscles of the eye. Here are some of the nerves that are controlling it. This is optic for vision, right? It doesn't touch the muscles. It only controls the ability to see something close, far, or let light in, or it's essentially, so there's a reflex that happens. And this is where we're going to get a little bit more technical, and I want to see if you guys can hang. So I have the brainstem, right? Remember we did this, and then we have the pons, and then we had the medulla oblongata, and we said cranial nerves 3, 4 were associated with midbrain. What about pons? 5, 6, 7, 8. Who do we appreciate? And then we have 9, 10, 11, and 12. So let's say that I damage the midbrain because I have a stroke, and the stroke causes occlusion of blood supplying the midbrain. Now, what two nerves are going to be affected? Depends on what part of the midbrain, but we're going to say all of the midbrain is affected. So cranial nerves 3 and 4 are affected. What happens? Well, 3, here's one of the things with 3. In addition to being a muscle or controlling the muscles of the eye, it actually assists with pupillary constriction. So it's response to light. So if I hold up my hand here, there's light on that side, and I shine a light on one side, it'll cause that side to reflexively constrict. What happens to the other side? Well, it'll constrict as well because the information traveling from the eye here will pass back to the brainstem and then communicate to the other side to communicate to the other eye. So that's a pupillary light reflex. Now, if I have brainstem damage because of some kind of stroke or whatever happens, what's going to happen? The light reflex is not going to occur. It might not occur on the same eye, and it also won't occur on the other one if there's damage on both sides. So that's great. We understand 3 and 4 are part of midbrain. What about 5, 6, 7, 8? 5, 6, 7, 8 are part of the pons, right? Pons, yay, pons. And 5 is facial. So how do I test for facial? Well, facial is pain, temperature, and crude touch. All I have to do is stroke their face with something so that I can test for any kind of nerve damage in what 3 parts? The oh my, trigemini. So there's actually 3 branches, and I can have injury to either one of the 3. So I could stroke the top with a Q-tip, or here, I could do the jaw, anywhere that you're testing. What about 6? 6 is still with the eye, and you can tell them to look to the side. If they're not able to, or if you see movement of the eye toward the middle, then you know that maybe they have a deficit in that nerve. Whew, this can be super clinical. And then 7 and 8, obviously 8 is going to be for testing hearing, and they do have tests for that. And later on, we'll talk about those tests. And then 7 is facial, so all you have to do is make them smile, right? Because this is all facial expression. Okay, horrible. I do this to my son. He must, yeah, I must drive him nuts. And then 9, 10, 11, 12, you guys can figure all of those out. 9 and 10, they kind of work together in the gag reflex because 10 also supplies a portion of the neck. So 9 and 10 do work together with gag reflex. 11, how do you test for that? Like I said, you put your hand on one side, have them push against it if there's weakness, or you put your hands on their shoulder, and when they elevate, right, if there's weakness, then you know that there's some kind of deficit, and maybe the medulla oblongata and cranial nerve 11. And then 12, how do you test for that? Well, tell them to stick out their tongue. Didn't you have to do this at the doctor's office when they go, right? If you have a deficit on the right side, on one side, that means the nerve is weak. The muscles are probably going to be weak because the nerve is not pushing it as hard or not stimulating as much. So if I stick out my tongue, the weak side, the tongue will move toward the weak side because that's the side that doesn't have as much input. So the other side will be stronger. It'll push toward the side that's weaker. Woohoo! Here's where it gets a little bit harder. So we're going to say there's several ways to memorize the order. I never do the order when I'm teaching it. Why? Because you will never go back to this order, except for when I ask you whether or not it's sensory, motor, or both. So, on old Olympus's towering top, a Finn and German vault and hop. On old Olympus's towering top, a Finn and German vault and hop. Or you could do the dirty one, which I can never remember unless I write it down. So I'm going to write on old Olympus's towering top, a Finn and German, a vault and a hop. I know there's another word for this, but I don't know it. Okay, so in order, for those of you that need something that's a little more non-PG-13, is O, to touch and feel a glistening vagina and hymen. I could not remember that, but this is for those of you that might need that kind of mnemonic. Obviously, I couldn't remember it that way because I memorized it my other way. But this is what students, some of them have used, so I'm just repeating it. Here we go. This is what the reason why I set it up this way is because I'm going to test you on whether or not it's sensory, motor, or both. And you have to have this understanding in your head. So you have to say, some say marry money, but my brother says big brains matter most. So, some say marry money, but my brother says big brains matter most. Some of you are like, that's too boring for me. So we're going to change up brains. Some of you, let's say, let's do for the guys. So some say marry money, but my brother says big boobs matter most. One more time. Some say marry money, but my brother says big butts matter most. And then for ladies, some say marry money, but my brother says big balls matter most. And we're talking about basketballs. 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 Okay. So what does that mean? O, olfactory, right? Olfactory is only sensory. Optic is only sensory. Okay, so cranial nerves 1 and 2 are just sensory. We can simplify that. Cranial nerves 3, 4, and 6. We already know what those are for, right? So we don't have to do anything other than memorize that 3, 4, and 6, which was SO4, LR6, and A3 were all examples of motor. We can simplify that down. So you don't even need the mnemonic, but it's pretty helpful for the ones that you're like, I don't remember what it is. So 3, 4, and 6, 5. We said it was for pain, temperature, crude touch, but it also helps with muscles of mastication, which are item, right? So we said bitum. Some of you are like, I don't remember that mnemonic. That's fine. Bitum is just the muscles that are associated with chewing. Item are the ones that are controlled by cranial nerve 5, also known as trigeminal nerve. So cranial nerve 5 is both. Cranial nerve 6 we already did in this group, and then 7 was both as well. You have facial expression, and then you also have taste sensation to the anterior 2/3 of the tongue. So it has both. And then cranial nerve 8, auditory, that's only for hearing. Cranial nerve 9, glossopharyngeal. In order for you, 9 and 10, in order for the gag response to occur, I have to sense it, and then I have to respond with some kind of motion, right? So glossopharyngeal and vagus, cranial nerves 9 and 10, have both sensory and motor components. And then 11 and 12, that one's easy, right? So that one's just motor. So enjoy, have fun through this list. We're just going to walk through the rest of the slides so that you guys can see what's going on. Trigeminal was pain, temperature, crude touch, and muscles of mastication. So it controls both sensory and motor components, or has both. And it is trigemini. Oh my. So where is the O? Oh ma trigemini. Here we go. Oh my trigemini. If you go into med school, this is the most fun pathways ever. I had to help with looking at a skull and then trying to show the students what holes these were actually passing through to get to their final endpoints. So, oh my trigemini, V1, V2, V3. And then here's the component that has both motor and sensory. It relays back for muscle innervation here. 7 days a week, ladies. It's all about the face. All about the face. And then cranial nerve 8 for you know what? I will do this. For some of you that are going into medicine and you want to review back to these videos, this is not going to be tested out for you guys. So there are 7 branches of the cranial nerve 7, and there's 2 ways to do it. I always remember to Zanzibar by motor car, to Zanzibar by motor car, to Zanzibar by motor car, to Zanzibar by motor car. And then I think somebody else said 10 zebras bit my cookie. 10 zebras bit my cookie. That's mnemonics to help those of you that are going into medicine, like medical school, and you need to memorize this. Or even PT, they might have this as something that they're going to test on. 10 zebras bit my cookie, or to Zanzibar by motor car. And these are just branches that supply different parts of the face for muscles of facial expression. Vestibulocochlear, huh? What did you say? Huh? I can't hear you. Cranial nerve 8 is auditory nerve, also known as vestibulocochlear. Vestibular branch is for equilibrium, cochlear is for hearing. So what else do we have? We're going to just move on from there. We're going to talk about this later. We talk about the transmission of sound as it passes through the auditory canal or auditory meatus through these 3 bone structures, also known as ossicles, and then finally into the cochlear for sound production. And glossopharyngeal 9. And then vagus 10. You guys can review that and slow it down, pause it, do what you gotta do. And remember, it's a traveling nerve, right? It travels through the throat to help in gag reflex. It also travels to all the internal organs as the parasympathetic nervous system. So it is the brake for the heart and all the structures here that you would need to run if you were scared. And then it is the gas for the GI tract and stimulation of processing food, right? And then 11, accessorized ladies, right? So cranial nerve 11 is associated with trapezius and sternocleidomastoid. So you guys can look at some of that. Hypoglossal, that's the last of it. And then here's your review. So what structures make up the peripheral nervous system? We kind of went over that. We said that was the autonomic nervous system and the somatic, which includes motor and sensory. So SAD-MEV, 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 SAD-MEV. And then what systems are subcategorized? We just went over that. And then what about autonomic is, we're not going to cover that until a little bit later, but just understand autonomic, automatic, involuntary movements. What are the different types of receptors and sensations that are associated? This, I actually should put this, I'm going to put this again later because this one is seen with sensory pathways. And then what is the structure of a nerve? You guys can go over that. What is sensory also called? This is SAD. What is motor also called? This is MEV. What are the cranial nerves? Just did that. Are they sensory and motor or both? And then what are the parts of the brainstem? And then are all of them associated with the brainstem? And then know the pictures.